Well, good morning. Before I start about the topic of the day, I just want to briefly mention that today is 9/11, and so our thoughts and prayers go with all the victims from that event and all the service people and still serving our country in Afghanistan and all the soldiers we've lost, and hopefully we can just continue that support for them. So I just ask all of us to make sure we spend that extra moment to say thank you, and that we're going to continue moving forward in a positive way and remember their great sacrifice for our country. The topic today is an exciting one because it is about reinventing Michigan. If you go back to the original top 10 list for the reinvention of Michigan, number 9 on that list was reinventing our healthcare system. And the topic today is let's move forward with that. When I did a health and wellness message last year, I specifically talked about Blue Cross Blue Shield as an opportunity to modernize our system there. They've played a great role in the history of our state. If you look at the history of Blue Cross Blue Shield, they go back to, I believe, 1939 and have been a major contributor in terms of health care coverage. They cover millions of Michiganders' lives. But if you look at it, their regulatory scheme goes back to Public Act 350 of 1980, which was 32 years ago. And at that time, part of the regulatory scheme that was put in place is they were essentially made the insurer of last resort and had a fairly unique status in our state. Times have changed. And if you look at where federal law in particular is going in terms of health care, it's getting much more to an open marketplace where under federal law, insurance companies will be required to provide insurance to individuals, regardless of their health condition. So this is an excellent opportunity to say we should update. We should move to the 21st century with our rules and regulations to keep up with that and actually make sure we have more cost, quality, and access to health care to our citizens. And this is a good way to do that. So what we've done is put together a proposal to reform how we have Blue Cross operate in our state. So we put together a legislative package. We put together a package to work with Blue Cross Blue Shield and their board of directors on. And it does several things. One of the first things it does, it will transition Blue Cross Blue Shield, its relatively unique status, it's going to transition to a nonprofit mutual insurance company, which means it'll be like many other insurance companies in our state that are mutuals. If you look at the history of blues across the country, I believe there are 18 states where this transition's already been made, and the Blue Cross organization in their state is a nonprofit mutual. Hopefully I've got that one right, Kevin? Yes. And if you look at the status of that, it's something that's happened in many other places, but I think we're doing a better job here in Michigan about the process we're going to make that happen. So Blue Cross will be a marketplace competitor. It will be working under the normal insurance regulatory rules, and if you look at it, it will be a player that can compete with everyone else in terms of offering hopefully lower cost, better choices of health care to all our citizens. And I think that's exciting. As part of this process, though, there are several other unique attributes that I think are exciting. One is they have had a strong social mission. As part of that, they're going to be contributing a significant amount of money to a nonprofit. That amount of money will be $1.5 billion, approximately $1.5 billion over the next 18 years. And that will go into a nonprofit that will have an independent board, and that board will focus on how those dollars can be deployed to ensure better health care for our citizens. And I hope in particular there could be an emphasis on our most in need, our children, our seniors, but that will be a process that the board will be part of deciding how to best to deploy those dollars. But I think it's really exciting to have those additional resources available. The other part of the transition is Blue Cross Blue Shield will also be paying the premiums tax and state and local taxes and other fashions that could amount to about $100 million a year. So that will provide additional resources. So these are very good things going on for us, in addition to making them a good competitor in a marketplace where they can grow. One other feature I'd mention as part of this process is they will remain a Michigan organization. The idea here, this is not a sale of Blue Cross Blue Shield. And the point here is we want them to play an important role in our state, so they'll be continuing as a major presence in Michigan. and hopefully a successful organization that's creating jobs, that's providing great health care. So I think those are all very exciting things. One other part of the transition I'd also mention that was already an agreement that had been put in place is we're going to continue the protection for seniors on their Medigap coverage for the next 4 years. That was previously agreed to. That's going to continue as part of this process. Because again, we want to make sure this transition takes place. And I should mention the transition date. The transition date for these activities is really January 1, 2014, which is when the federal laws take effect. So all this is aiming towards January 1st, 2014 in terms of these reforms. So it's great. I'm up here with a group of people. I also want to give them a chance to make some comments. We have had great teamwork on this, as you can see the group, but in particular I'm going to start with the legislative side. It's great to have Senator Hume with us, that he's going to be a true leader in this process. So I'm excited to have Joe here. We have Pete Lund also joining us from the House side. So I'm going to ask each one of them to make a few comments on how they see this process moving forward, because it's, again, about good partnership with the legislature. Teamwork. Thank you, Joe.
Thank you. Thank you, Governor. Thank you, and thank you all for joining us. And I think one thing that's important to stress is that this legislation is strictly optional. The mutualization of Blue Cross Blue Shield will only occur if the Board of Directors of Blue Cross Blue Shield votes to switch to a mutual company. Again, this isn't the state of Michigan coming in and seizing their assets and privatizing this company. Absolutely not. That is not the case. That's not something that the legislature would support. This is strictly optional, and it will allow the Board of Directors of Blue Cross Blue Shield to help transition into some innovations of this market. Some other things that the legislation will protect is there's some Medicaid fraud issues that the legislation also protects in there. And it will maintain the nonprofit status of Blue Cross Blue Shield, just as the governor mentioned. They will continue to be operating as nonprofit, just in a little bit different form, a little bit different fashion in the time to come, if the Board of Directors so chooses. The timeline for this, the Senate Insurance Committee met, I think, a handful of times on how the Blue Cross Blue Shield operates and how PA 350 is operating in today's market. We met a handful of times a few months ago, and we're looking forward to doing our due diligence in an expeditious manner, working with Chairman Lund in the State House. And I think I get to call up Chairman Lund next, if that's okay, Governor. I look forward to the discussions to come and doing what's right for the people of Michigan. So thank you.
Thank you. Clearly, Joe has a little bit more information on this than I do. I'm looking forward to this, but I have got nowhere near the amount of information that he has. What I do have are a lot of questions, and I think we all do. And I can promise you that in my committee, this is going to get a full hearing on both sides, people for and against it, and we plan on looking very closely at all of the details here. I expect my committee to be putting in a lot of time. I'm not sure exactly the timeline. The Senate will get it passed, but I think we're going to start some hearings on the conceptual nature of the proposal before we even get a bill from the Senate, so our members can start thinking about it and working on it. But we need to keep in mind that there's a lot more people involved in this than just the Blues. The competitive nature of health insurance is important for the people, for the consumers of Michigan, and that's going to be one of our focuses, as well as we're going to focus on, as the governor mentioned, the jobs. Blue Cross is a major job provider in the state. I think what we need to do is try to create a situation where not only are they allowed to keep the jobs they have, but hopefully find a way to actually grow and expand and provide more jobs here in Michigan. And so while I think we have a lot of different goals here, I think we can handle this, and I think it's something we can turn this into a net positive for the state of Michigan, for both the government, for Blue Cross, for its subscribers, and most of all to the entire people of Michigan. People can benefit from this, even if they're not a Blue Cross member. If they don't get their insurance from Blue Cross, they can still benefit from what we're going to do here. And I think that needs to be our goal. I'm not sure who I'm supposed to turn it over to.
No, and what I'd like to have several department heads make some comments, because this has been real teamwork, and I want to thank the people on stage. And first I'll turn it over to Commissioner Clinton, who's done just an outstanding job, not only in this area, but with our insurance industry. So Kevin's done wonderful work, and I'd like him to share some thoughts on how he sees the regulatory environment that would go along with this. Kevin?
Thank you. Throughout my tenure, I've had a number of health insurers come up and say, give me a level playing field to compete against. Well, Governor Snyder's proposal will level the playing field among all of our health care insurers. Overhauling how Blue Cross is regulated and requiring every company to play by the same set of rules brings equality and balance to the state's health insurance marketplace. The governor's plan will improve the quality of insurance products and give consumers more options to choose from. It also streamlines our regulation of the state's health insurance industry and increases the administrative efficiency of our agency. Consumers should rest assured that the Office of Financial and Insurance Regulation will continue our strict oversight over the Blues. But now the company will be governed by the state insurance code, the same set of laws that OFR uses to regulate other health insurers. Our oversight includes on-site examinations, solvency requirements, market conduct analysis, and the review of the Blues rates and forms. And just like through our supervision over other companies doing business, we will ensure that our regulation of Blue Cross and the code is strictly enforced and that our consumers remain protected. Thank you.
Thank you.
Next, I'm excited to actually have one of the newest members of our team come up and speak because he has vast experience, but I'm very excited to have him on board, and that's Director Habeman from the Department of Community Health, and just ask him to share a few thoughts on public health, the issues associated with this transition. So it's great to have Jim with us. Thank you, Jim.
Thank you, Governor. Michigan has to be a healthier state. If you take a look at some of the statistics, and many of you have reported on them, you'll see that we're not near the top on a lot of the behaviors that relate to children, whether that be with childhood trauma, obesity, hypertension, access to care, stress on families, risk assessment, early identification of autism, health homes for children, early identification of diabetes, health disease. And we need some help in developing policies and thinking through the complex strategies as we're going to navigate the future in healthcare. And the entity that's being proposed and the dollars that will be put into this nonprofit will go far to jumpstart a whole lot of creative thinking in this state. And the benefits that's going to come from the departments and the partnerships that we form together is going to be a healthier Michigan. We'll have a healthier economy, because the children today are the ones who are going to lead this state in the future, and we want to make sure that they got the best platform possible to go forward to lead this great state. Thank you.
In addition to Jim being here, I also want to thank Carrie Cederberg, our Director of Office of Aging, for being here, because again, it's about teamwork. Kids and seniors in particular are an area of concern. Given the long list of speakers we've had, and I know there's a few questions, I'm not asking Carrie to come up, but she's done great work on this project, so I appreciate that. The last person I'm going to introduce is our Laura Director, because Steve Hilfinger's been a key part of this process, working with Commissioner Clinton on bringing this all together. But it really fits into our entire scheme for regulatory reinvention for the state of Michigan, so I wanted Steve to share how this fits in the big picture of things. Steve?
Thank you. Again, as Governor Snyder said, I'm Steve Hilfinger, the Director of the Department of Licensing and Regulatory Affairs. OFR is an independent agency which is part of our department, and OFR has responsibility for regulating the health insurers and other insurers in the state. So I would echo what Commissioner Clinton said about the role and purpose of OFR. In the governor's special message last September, he did express a need to take a fresh look at the way we're regulating Blue Cross and Blue Shield. And since 1980, there have been significant changes to the market in health insurance, the use of technology, the development of products and other innovations, and then significant changes in the regulatory area and reform. So all of this really necessitates a reinvention and modernization of the way that we regulate Blue Cross and Blue Shield. PA 350 has served us well, but really it's outlived its useful life after 32 years in our current environment. And the opportunities afforded by the changes in health care afford us a chance to take a new look and really establish a new baseline for a more effective market here. The proposal announced today, if enacted, will enable Blue Cross and all of our other health insurers in the state to serve our citizens better. We believe the change will foster more innovation and better customer choices and service while maintaining broad access to our health care system for all of our citizens. This plan is part of the governor's larger vision to reinvent state government and our regulatory structure, which is part of what our Office of Regulatory Reinvention participates in, and this is a key part given the significance of health care to our economy. There's a lot of details that remain to be discussed, and we look forward to further legislative discussion and discussion with all of our stakeholders. And I'd just like to thank the governor for the opportunity to participate. Thank you.
Well, great. You can see why I'm excited today. This is good stuff.